Hello, my name is Anna Stafford. I'm a nurse with Tulare County Child Welfare Services. I'm going to give you a presentation of as I would make this to a class of nursing students. This is meant to be a much longer class than this is in the 8 to 10 minutes that I'm going to give you. So keep that in mind. I try to zoom in so you can follow along. Each student will be given a PowerPoint with scenarios and things that you'll see on the end, as well as they were asked to print out an article and come prepared to class with it. So now I'm going to begin the class as though I was there. Good morning, class. How are you today? Today we're going to learn about asthma and obesity and if there is a connection. We have already discussed asthma, so I'm not going to go into detail too much, but I'm just going to remind us of the process of how asthma works. Today, at the end of this presentation, we will be able to describe the pathophysiology of asthma, relate how asthma and obesity are connected. We will list the medications to control asthma. We will demonstrate the appropriate use of asthma medications in scenarios, as well as relate one new thing that we learned today. Causes. Sometimes we have difficulties in class. Causes of asthma is allergens to plant pollens, sometimes irritants in the air such as aerosols, particle matter, pet dander in hair, smoke, and cold air can even trigger some asthma. What might we see signs and symptoms again? Chest tightness, coughing, wheezing, shortness of breath. Some people get very anxious. Some of the kiddos that I work with, they feel like something is pressing on their chest, or they may say they feel like a fish that's out of water, they cannot draw a breath. What are the comorbidities? What things can go along with asthma? One of the, and we talked about, is seasonal allergies, rhinitis, sinusitis when you have a lot of sinus infections, GERD, sleep apnea, as well as what we're going to talk about today, which is obesity. How does asthma work? We have the airways, and the outer bands of the airways are triggered by an allergen, irritant. Could be exercise or cold air, and so it begins constricting on the outside. Then we have, which narrows the bronchioles, and then on the inside we have swelling of the tissue, as well as mucus that can plug the airway. So we kind of have a three-way thing going on. Just talk briefly, intermittent asthma, mild asthma, moderate asthma, severe asthma. So an intermittent, it really may be 1 or 2 days a week and it doesn't really affect them. Mild, maybe they might be using a quick relief medication more than 2 times a day and a controller medicine. Moderate, about 50% of the time their activities are inhibited by their asthma, and then severe, it just feels like the whole world revolves around whether they can breathe or not. Genetics and lifestyle can play a factor in asthma. It can run in families, but today we're going to talk more about the lifestyle of obesity is a major contributing factor. Fatty deposits such as adipose tissue can prevent the lungs from expanding. I have a big belly right here, so that could be one of the problems that I can't draw a breath and I can't fully expel the air. So it has a decreased resting lung volume. Another part of lifestyle, lack of exercise. That lack of exercise doesn't strengthen the lungs, so I can't draw as deep of a breath. We know environments in the home and the air trigger things, so watch out if you have pets. Some people have grass, mold, pollution. We live in the Central Valley, so there's a lot of pollution here. Irritants. Smoking is a huge trigger for asthma, as well as your home. Some people don't think that you need to keep it vacuumed. With some of the severe cases, you might have to keep your windows closed all the time. I know for my grandchildren, we do have to keep the windows closed just because that dirty air will set them off. And make sure that you have pest control and bugs away from the home so that there's none of that debris in the home. We have different kinds of treatments. We've talked about these before. Rescue inhalers through the albuterol inhaler or nebulizer. And the cool thing about rescue inhalers to remember for the test, it works in minutes and lasts for a few hours. And it works to loosen the muscle bands on the outside. The controller medication works over days and lasts longer to decrease the inflammation in the airway. And then we use steroids for serious asthma attacks. What common common medications might you see? Well, some of the long-term controller medications, the inhaled corticosteroids, reduce the airway swelling. So we've got Flovent, Pulmicort, Qvar, and you can see their generic names. And for the serious attacks, we use prednisone or methylprednisone. Methylprednisolone. So I can't say it. Common medications for quick relief would include albuterol, which is the ProAir, Ventolin HFA. I never heard of this one before. Combination inhalers, which are corticosteroids and a long-acting. We have Advair, very common in this area, Symbicort, and I have not heard of Breo, but I kind of have heard of Breo. How do we diagnose? We talked about this. Spirometry, we breathe into the device, and it tells us how much air is going in and out of the lungs. We can do an x-ray to see how much damage or if there's consolidation included with maybe possible bronchitis or pneumonia. We can do some blood work, and then we can actually do a bronchoscopy where we go down and get some of that mucus to have it tested to see what's actually in there. When we use the medications the way they're meant to use, we will have this expected outcome that there will be, with the controller medication, there will be a reduction in inflammation and allow for easier breathing. But with a rescue inhaler, it'll be used for triggers such as exercise, cold air, pollutants, and irritants. Okay, obesity-induced asthma, what are the risk factors? Well, BMI is a very strong risk factor, and it's been found in the studies that children who have increased their weight greatly before the age of 2 are at a greater risk factor. They also will have altered respiratory function in infancy, and there's some studies that say it may start in utero. Another part is, you think about the distribution, I got a big belly here, so it's inhibiting my lungs, me from drawing that full breath or getting all of it out, so it leads to leaving some of that in there. Also, the composition of adipose tissue, there are things in it that will increase inflammation, and as we know, we already have inflammation, so that's going to put us at risk for asthma. Adult women, postmenopausal, are at greater risk for obesity-induced asthma. How do we improve this? Well, obviously weight loss. One of the ways it will help is the lungs will not be as restricted when drawing a breath. Our diaphragm will no longer be stiff. The stress, which will be reduced, and it will increase the resting lung volume, so we have more air to draw up. We'll get better sleep, decreased inflammation. You can see all the improvements in the asthma, lung function, quality of life. And how do we improve? Another one besides weight loss is take our medications regularly. We talked about that. Long and short reasons. So take out your scenarios on your PowerPoint that it was handed to you. You all have a piece of paper in groups and you have markers, and so I want you to write down the answer to this as well as discuss some of the information from the article over here that you were to print and read. So I would give them some time, and then we would have a report back to the group as well. We would discuss the answers. The patient, so the scenario was on a hot July evening. The patient arrives at the emergency room with shortness of breath, wheezing, chest pain. He suddenly came on when he was outside practicing soccer with his children. He never felt pain like this before. He has trouble catching his breath. His O2 is 85%. Respirations are 25. Blood pressure 120/65. Placed on 2 liters of oxygen by nasal cannula. He suddenly begins to have a coughing fit and cannot seem to catch his breath. The nursing student assesses the patient and shows understanding of the situation when he raises the head of the bed, repeats his vital signs after a coughing fit, asks the ER tech to start a 12-lead EKG, and calls the doctor and asks for RT to administer albuterol via nebulizer mask. So go ahead, class, talk about this, and then we'll go over the answers. Say I'll be given some time. Oops. The answers are, the patient is in the acute phase of asthma and it can last for minutes up to an hour. Raising the head of the bed is a good idea, but not the most important. Gotta love NCLEX. At this point, the EKG is not warranted because the chest pain is more than likely related to the bronchospasm of the lungs. There will be also edema and mucus secretions. The patient should respond to the treatment, and the albuterol will open the airways, allowing the oxygenation to occur without needed as a nasal cannula. And this is more than likely exercise-induced asthma, and the patient will go home with an albuterol inhaler to take 15 minutes prior to any activity. And then they will go over these questions. What medications would you choose? So class, using the medications and what they're used for in your PowerPoint, I would like for you and your group to answer these questions and report back to us. As we wrap up the class, how many of you have dealt with or do have asthma yourself or someone in your family? So then you kind of had some understanding of what's going on. I want to thank you today for coming to class, and I will see you later. So at this time, I'll end the class, and thank you for listening.